Well, finding medical care on the rural neighbor islands has always been a challenge because of a shortage of doctors. But now it's getting even harder. KITV4's Kristen Consillio joining us now to explain why some Molokai residents are now facing a crisis in their health care. Hey, Kristen.
That's right, Tom. A decades-old health center is closing on the Friendly Isle, leaving many Native Hawaiian patients without a doctor. With the passing of famed Dr. Emmett Aluli late last year, his Molokai Family Health Center will be closing on January 25th, and that's leaving a big hole in medical care for nearly 2,000 patients.
I don't have a doctor right now. So yes, I do feel vulnerable. If something was to happen, I'd have to go to ER. It's really scary.
Dr. Aluli practiced medicine for more than 4 decades on the island with a population of about 7,000 people. And at one time, the center was the only clinic on Molokai. Patients describe the type of care he gave as old-school medicine, a family practice doctor who did home visits and knew generations of your ohana.
And he would scold you if you weren't doing something right because he knows your family history. I mean, it is beyond tragic, and it's a huge hole in our community with his passing.
Besides Aluli, another prominent doctor passed away in recent months, and a third practitioner is retiring, leaving many of the island's patients without primary care providers.
Molokai is so rural that it is difficult for us to attract doctors to come and serve our community. Like, there's some family, 4 generations he's been their doctor, and so now the transition is really hard. It's rebuilding trust in your healthcare provider, and for Hawaiians especially, that's a hard thing to come by.
There are still 3 main providers on island: Molokai General Hospital, Molokai Community Health Center, and Napu'uwai Native Hawaiian Healthcare System. But residents say more must be done to build up the healthcare system and help homegrown physicians financially so they can come back to practice.
But what's tragic is not one of the Molokai kids he's mentored practices on island.
A problem state leaders say they're working to address.
Well, it is major crisis, and when living on an island like Molokai, we put the word out there for doctors to come, and most doctors, they want to come and they take a look at the situation and don't like the lifestyle. So it's just a challenge for us to get them to the island to practice.
What is the solution? I mean, any solution? Because rural healthcare is just getting harder and harder, especially with the nationwide shortage of doctors.
Telehealth, telemedicine is an alternative.
Now, Aluli's office says he tried his best to find another physician to take over the rural practice, but that never happened, in part because of a shortage of doctors nationwide. Kristen Consillio, KITV4 Island News.